My name is Dr. Pamela Weber, and today I want to discuss maintaining vision through life. How does the eye age? I think we can think about the aging of the eye by looking at different parts of the eye and how we can be proactive to slow down this aging process. And I think it's important to consider genetics, epigenetics, and the environmental impact. So when we talk about genetics, there can be a genetic predisposition to certain types of eye disease associated with aging. Now, genes are the molecular roadmap of our bodies and something that we inherit from our parents and then pass on to our children. Epigenetics refers to changing the outcome or modifying the outcome of certain troubling genes through lifestyle. And then, of course, through the environmental impact on people regardless of their genes, such as oxidative stress from UV light and oxidative stress from smoking. Now, I want you to think about the different parts of the eye. The front of the eye is the cornea, the clear covering. The iris lets light in and out. The lens, which we will be talking about a lot today, is the crystalline piece of glass that helps focus light onto the retina, which is in the back of the eye, and is the electrical grid that changes light into an electrical impulse that's decoded in the brain. The macula is a subdivision of the retina that gives you your very, very best vision, your driving vision and your reading vision. Now, as we age, things happen to the retina. There is loss of neurons in the central and the peripheral visual pathways. There is age-related loss of neurons in the inner retina. There is loss of cells in the retinal nerve fiber layer. And these can make the visual systems much more vulnerable to normal disease processes such as glaucoma and age-related macular degeneration. So that's why as we age, it's really important to keep up with our eye exams so that we don't have damage from these other conditions, which we are now more vulnerable to. I want to talk specifically about macular degeneration. This is a huge health concern across the world with millions of people affected. And in fact, almost 20 million Americans have this disease. There is a genetic component to this disease, and it's probably about 70%. We can do AMD genetic testing to help figure out how likely it is that you will progress and how likely it is that you will pass it on to your children. Epigenetics and environment play an important role too. We can slow down the disease process by not smoking, eating a healthy, rich diet, and with lots of dark green vegetables, wearing sunglasses, and maintaining good control of our cholesterol and blood pressure. We can also use AREDS 2 vitamin formulation with or without zinc, which can also slow down the disease process. And we figure out which AREDS 2 is best for you with genetic testing, which can be done in my office and other retinal offices. This is the retina of someone with dry macular degeneration, and you can see that there are little drusen, the little yellow spots in the macula, which is the hallmark of this disease. This is a patient who's progressed to the wet form, and in this disease, we can see that there's abnormal blood vessels that are leaking blood and lipoprotein, and this can cause a sharp decline in vision very rapidly. I want to talk a little bit more about the AREDS 2 vitamins because I think it's a very confusing thing. AREDS stands for Age-Related Eye Disease Studies, and these were studies that were conducted by the NEI, the National Institute of Health, which is part of the NIH, the National Institute of Health, and these are funded through the U.S. government. The vitamin and mineral combinations that were studied in these large clinical trials, it was determined that these supplements can slow down the progression of dry macular degeneration in certain patients. Now, the AREDS formulation 1 had beta-carotene, but as years went on, it was discovered that this beta-carotene can actually increase the risk of lung cancer in patients who are smokers. So AREDS 2 took out the beta-carotene. And so what we now have in the AREDS 2 formulation is vitamin C, 500 milligrams, vitamin E, 400 international units, copper, 2 milligrams, lutein, 10 milligrams, zeaxanthin, 2 milligrams, and zinc, 80 milligrams. So if your genetic testing shows that zinc is not good for you, then you need to use the AREDS formulation without zinc. Now, the AREDS formulations with zinc include Preservision and Ocuvite and others, but these are a few examples. I do not have any interest in these companies, so I'm not sponsoring any of these companies, but just giving you an idea what to look for. Preservision and Ocuvite are readily available in drugstores and and grocery stores. AREDS 2 without zinc are a little harder to find, but you can find them on the internet. So what should you eat? Well, this is a typical diet that would be great. Salmon, which has omega-3s, dark green leafy vegetables for the antioxidants, red wine for the antioxidants, and of course dark chocolate. The red wine should be used in moderation, of course. What about age-related cataracts? Well, the crystalline lens, when it ages, becomes opacified, and that's what a cataract is. It should be crystal clear like a plate of glass. Genetic studies have shown that it does run in families, and if it runs in your family, you might have a 3-fold increase in getting this. Diabetes, which also runs in families, can increase the risk by 5-fold. Epigenetics and environment can slow down the disease process by not smoking, wear your sunglasses, and eat right to prevent and manage diabetes. And this is what a cataract looks like. You can see a white opacification behind the pupil. So you can see that there's some common threads in these diseases that we can slow down the aging process by controlling these different things. One is smoking, one is UV exposure, and the third is diet. So think about this in your life and think about getting better control of your diet and wearing your sunglasses and of course not smoking so that you can age better and maintain your vision. Thank you.